So if we were going to record a podcast a year from today, what kind of key things are you targeting for Shadowbox as it continues its journey, as a company?
Probably the number one thing that we are working on is ensuring that our network of customers and our utilizers, the end users of practices, continues to grow. Because there's a network effect of we have more EHRs in our library, we have more service providers in our customer set, we're able to more effectively move data back and forth. And that means a lot of different things internally that probably too boring to talk about here. But what ultimately our objective is, if you think about that at scale, is to enable service providers who are outside of the healthcare space themselves. So now a year from now, maybe a year and a half, I'm talking about the social determinants of health. We're talking about homeless service providers and food kitchens and rehab centers and others that aren't necessarily within the standardized health services community, hospitals and health plans and doctors and surgeries and so on. That entire group of entities are completely outside of the data infrastructure that lives within the healthcare space itself. They don't have the same coding in terms of diagnoses and so on. So information that is entered into a homeless management information system isn't directly translatable or useful for the ER where that person might show up, right? And there's no connectivity. So the opportunity that we believe is that Shadowbox will enable is, because we're simply a browser that is downloaded and installed in a couple of minutes and you're up and running and creating interoperability, is you could drop a Shadowbox on a HMIS, Homeless Management Information System provider, and Shadowbox will, if authorized and enabled, be able to extract appropriate data and convert that data into codable and readable information that can be then sent to health information exchanges or hospital systems or so on, so that the patient at the end of the day, no matter where they're seeing services, they can have a complete continuum of care of all of the services that they're receiving from wherever they are.